The first talk is a project I've been working on for a while now called ALS Untangled. And I've nicknamed this talk, Reopening the X-Files. Hopefully most of you remember what the X-Files were. It was a TV show, my favorite show, ran for about 10 years. And the idea of this show was there was a guy named Fox Mulder. And when he was a kid, he was supposed to be watching his sister, Samantha, and she disappeared. And the way he remembered it, she was kidnapped by aliens. But of course, nobody believed him. And so he spent the rest of his life trying to prove to the world that aliens and other similarly strange phenomena were real. Now, every week there'd be a different episode, and it would start off with another one of these strange things. And usually, Mulder and his team would investigate and find some rational explanation. So this was my own Samantha. Early on in my career, this was a 60-year-old university professor that came to see me in my Duke ALS clinic. She was somebody who had a pretty obvious case, unfortunately, of ALS. And at the time, she was pretty early into it. Just a slight amount of slurred speech, a little bit of arm and leg weakness, still independent, still able to walk with a brace, still working. No obvious cognitive or behavioral problems. So I sat down and I had that terrible talk with her about what ALS is. And then I told her about the things that we could do. I offered her evidence-based, stage-appropriate care options. And finally, I asked her if she wanted to be in one of our research studies. She told me that she'd be happy to take the care options, which were Riluzole and the multidisciplinary team, but she didn't want to be in the research study because she had decided to do her own research on herself. She was going to take something called oral sodium chloride, something that she heard about on Good Morning America. And so for the purposes of this talk, I'm going to use this as an example of something called an alternative or off-label therapy. And I'm going to abbreviate those AOT and define them as something that's advertised to slow, stop, or reverse ALS progression without what most scientists would consider to be very good evidence. Now you can imagine the first time I heard a patient say something like this, my face looked a lot like that of Fox Mulder when he really did see aliens for the first time as an adult. And I drove home that day and I scratched my head and I said, I wonder if this is common, that people with ALS would try unusual things like this on themselves. And did a little literature search, and it turns out it is. Whether you ask doctors about this or whether you ask patients about it, the answer is the same. And that is the majority of people with ALS will try at least one alternative therapy over the course of their disease. Why would they do that? Well, the answer is obvious, right? So this is one of the world's worst diseases. And unfortunately, we have very few proven treatment options right now. The things that we're testing, we hope, will slow down disease progression, but we don't really have anything on the board right now that looks like it's the cure for ALS. So like this old X-Files poster, patients and families want to believe that there's something better out there. So when you ask them, why are you trying these unusual things, 10% say they think they're going to find a cure, 20% think they're going to find something that will at least make them better, 50% think they're going to find something that might slow progression. And then other very common answers that I've heard over the years, peer pressure. So what does that mean? It means somebody in the family spent some time on the internet and they came up with this idea for me to try, so that's what I'm going to try. And then finally, my favorite one is, Doc, I already have ALS. What worse could possibly happen to me? So into that background comes the internet, which makes it easier than ever for people who want an alternative therapy to find one. So if you go home and you Google search ALS treatment, you'll come out with more than 30 million hits. Now, most of those are not alternative therapies, but many of them are, including some of the first ones that come up. The other thing about the internet is that although there's a lot of information, a breadth of information, there's very little depth. There are no internet police. So people can say whatever they want on the internet and nobody can really hold them accountable. So very commonly, people who are selling alternative therapies in ALS make the following two statements. One, clinically proven, and two, perfectly safe. So here's an example to show you what I mean. You may not be able to read it from back there, but you do have your handouts. So this is a screenshot that came off of a website that a patient brought to me one day in clinic for something called MotoTab. And you can see that it says, this is the world's most relied upon treatment for motor neuron disease. And of course, the patient asked, how come you didn't put me on this? And my face turned red. I thought I was an ALS expert, and I didn't know about the world's most relied upon treatment. But you can see what I mean over here on this side. It says, MotoTab is clinically proven, and you can download the study here, and it's completely guaranteed. You're at no risk for trying this. So it's kind of a thing that we chuckle about, but is there really a problem here? I think there is, right? Because the information that's used to back up claims like that, it can range anywhere from totally absent to slightly flawed to just completely wrong, just a complete lie, okay? So a good slogan comes from another X-Files poster: when dealing with things on the internet, trust no one. Let me give you some examples. You might say, Bedlack, how could somebody try to sell something and have no information at all to back it up? Well, here's how that works. So we go back to MotoTab. So I told you that there's a section here where they talk about a clinical study. So that's exciting. So it says, click here for details. And you click, and this is what you get. Clinical study soon to be posted here. So when did this website actually get started? It got started in the year 2003. So what clinical study is so large that it takes 12 years to upload onto the internet? I don't know, but it must be amazing. So in fairness to MotoTab, they do actually have a link to a seemingly independent group that did some sort of testing of this product. So MotoTab comes from a company called Oslo Health Solutions. And they've got a link on their website to a company called the Society for the Promotion of Alternative Health. And so here is what this company did to test MotoTab. They've got 4 assays. 1 is called traditionally proven, 2 clinically tested, 3 worldwide usage, and 4 short-term focus. None of these are defined. We don't know what exactly they mean. We also don't know whether having more check marks is good. Presumably it is. And if it is, the strangest thing of all is that MotoTab is the only one of these things that's clinically tested, and yet it comes in second behind something called Neurotax and just ahead of something called Ronotin, which I've never heard of either. More on that later. So far more common than that scenario where you don't have any information is this one, where there's information on the website, but it's flawed. And this is very difficult for anyone to sort out, even an ALS expert. So this is a graph that came off of a website for what was at one time the most profitable stem cell clinic in the world. It was called the Excel Center. It was located in Germany, and their idea was that they would take a person's bone marrow out, isolate the stem cells, inject those back into the spinal fluid and muscle, and that a person would get better. It's not a bad idea. In fact, there's a mainstream trial, which I'll talk about in the next hour, that's doing exactly that. So if you look down their website, this was a graph that they had in the ALS section of the website. And this is what happened to a group of 53 patients with ALS who went to the Excel Center and had this treatment. You can see that the majority of patients were either unchanged or improved after the treatment. Now that's amazing. That's not the natural history of ALS, right? So you could see why somebody would look at that and want to go there. But there's something missing from that graph. Does anybody know what it is? What is that test? What exactly are they measuring, right? So we finally got a hold of somebody at the Excel Center to get that question answered. And what we found out is these folks were just calling patients on the telephone, usually a week or 2 after they got back from the center, and asking them, so how do you feel? Do you think you're better, unchanged, worse? Well, if you had to design a study to look for something called a placebo effect, that would be exactly what you would do, okay? So a placebo effect is when you feel better because you want to be better so badly. And it's much more likely to happen if you take a treatment that's difficult to get, like flying all the way to another country, that's invasive, like getting a bone marrow biopsy and a spinal tap, that's expensive. This was more than $10,000. And it's also much more likely to happen when you measure your outcome just a few weeks after the treatment rather than a few months or years down the road. So they kind of picked a perfect scenario to find a placebo effect. That clinic, by the way, was closed down not long after we investigated them. There were multiple people that were injured, including a few people that died at that clinic. And then finally we come to this, which I think is the trickiest type of information to debunk of all. And that is information that sounds really good, except it's completely wrong. So this little vignette comes off my favorite website that I've ever found. It's for a person named Dean Kraft. And he called himself the most documented energy healer of our time. And his website really was a treasure trove of oddities. So there were dozens of little vignettes on his website. For example, you'd click on a date and up would pop a letter that said, "To whom it may concern, on July 15th, 1975, I saw Dean Kraft move a pendulum that was under a glass jar using only his mind. Signed, John Smith." I mean, there's no way to validate any of these things that are on there. But there was one that caught my eye more than all the others, and it was a description of a woman named Nelda Boos, who was reportedly diagnosed with ALS by one of the world's great medical centers, reportedly had progressed to the point where she was unable to move and was literally picking out her outfit that she was to be buried in, and then went to see Dean Kraft, and 2 years later was essentially back to normal, was able to run and throw her grandchild up in the air. Now, of course, that's not supposed to happen in ALS. And Dean Kraft wrote on here, "This was the first case in the medical books of Lou Gehrig's ever going into full remission. It is unequivocal proof that the laying on of hands can reverse terminal illnesses that have no treatment and no hope." Well, these days you can find almost anybody on the internet. So I reached out through all my social networks and eventually found Nelda Boos, explained who I was and that I was interested in her case, and she sent me all of her medical records. And as I was reading through these late one night, I remember turning to my wife with goosebumps and saying, "You know how people in the ALS world already think I'm kind of nuts? Well, wait till the next meeting when I stand up in front of everybody and say that I found the cure for ALS, and it's energy healing." Because as I read those records, I was absolutely convinced that this woman had ALS. She was really seen by one of the best medical centers in the country, University of Virginia. I know the doctor that saw her. All the right history was documented, all the right exams, the right EMG, all the right testing for ALS mimics. I'm sure she had it. I'm also sure she progressed to the point where she couldn't move. The notes say that. And finally, I'm sure that Nelda Boos is now back to normal, or at least close to it, that she can run and throw her grandchild up in the air, because I've seen videos from just recently. So I went to talk to some of my more senior colleagues, and I said, "Have you ever heard of anything like this before?" And it turns out there actually is a literature on something called reversible ALS, and it dates back 20 years. So there have been multiple, although rare, published reports of people with what looks like ALS just spontaneously getting better. So that may well have been what happened with Nelda Boos. Now, personally, I think anytime we see one of these ALS reversals, we need to study it. And in particular, we need to study the treatment that they may have been trying while they were getting better. No matter how strange it may sound, we should test it. So I reached out to Dean Kraft, and I explained that I would love to do a trial with him, that I would find funding, that I could either fly him to Duke or fly my patients out to him, and that if he could just make one more person better, he'd be incredibly famous and wealthy. And his response to me was beautiful. I'll never forget it. He said, "Richard, for those who believe, no proof is necessary. And for those who do not, no proof will ever be enough." So that's that. And now Dean Kraft, unfortunately, has died, so we will never know. The other big problem with these alternative therapies is that although all these websites keep saying that there's no harm, that it's perfectly safe, ALS Untangled has found multiple examples of harms in these clinics. So most commonly financial harms, Some of these treatments cost hundreds, some thousands, some hundreds of thousands of dollars per cycle. Second, there are psychological harms. All of you that have been affected by ALS know how hard it was to hear that, to hear what that means. Imagine if you were then told by somebody else that that was all wrong, and if you could just raise enough money, they could make you better. And then months or years later, when you find out that that's not true, imagine how you'd feel. It's devastating for some of these folks. Physical harms. So even in clinics that list themselves as perfectly safe, ALS Untangled has found evidence of infections, blood clots, heart attacks, deaths from the treatment. The most amazing example I can point to you about a physical harm that happened to a patient is actually not a patient with ALS. It's a patient with another neurological disease, terrible disease that affects children, called ataxia telangiectasia. So there was a couple that had a child that had this disease. It's a degenerative disease. They were desperate. They went on the internet. They found a stem cell clinic in Russia that said they could make that child better. They just raised $10,000, so they did. They mortgaged everything they had. They took the kid to Russia, got the stem cells, came back home, and a few months later, the kid started having headaches. So his neurologist did an MRI. And you can see something at the end of this arrow here that doesn't belong. This is a tumor. And when they went in and they biopsied the tumor, they found that it was comprised of someone else's cells. In other words, that family paid $10,000 for their child to be injected with cancer cells. And that's what happens when you go off the grid and there's no oversight. There's one more type of harm, and it's the most subtle type of harm of all, but it's important. It's scientific harm. And this comes from a problem that we have with enrollment. So it may surprise you to hear that enrollment in ALS studies is pretty low. Less than 2 patients per site per month enroll in a clinical trial. Overall, less than 5% of patients with ALS are getting into clinical trials across the world, which is shocking to me. There's a lot of reasons for this. We're going to talk about some of it in the next session. But one reason is exactly what Samantha said, and that is that on the one hand, you have a clinic telling you that they have a clinical trial where you might get a placebo, and it's really for the greater good. There's no guarantee that it will help you. And on the other hand, you have a person on the internet saying they can cure you. It's kind of hard, to go after the one over here. So it's not uncommon for patients to make the choice that Samantha was making. And there's some important consequences to this low enrollment. So right now, our trials are taking longer than they should. They're costing more. Some of them may actually be stopped because we can't enroll patients. And even if we do get a trial that finally works, we are not going to know if it works for everybody. Imagine if only a small percentage of people with ALS are coming into the trial. How do we know if those results can be generalized to everybody with ALS? And the bottom line is, unless we can fix this enrollment problem, it's going to take us longer to find the cure for ALS than it should, and that's just not acceptable to any of us. So what do we do about this problem? Well, there's 4 models by which decisions get made in a doctor-patient relationship. The oldest model is called paternalism, and in that model, the doctor is kind of acting as a parent or guardian to the patient. So they are defining the patient's values and goals, as well as the method by which those are going to be obtained. So if we were going to handle Samantha's decision in a paternalistic way, we would say, Samantha, that's just really not a good idea. I don't think you should go after the Good Morning America treatment. I think you should come into the clinical trial. That's what's best for you. A newer model that's really been fueled by the internet is called autonomy. There, patients define their own values and goals, as well as the methods that they're going to use to get there. And the doctor's job is just to do whatever the patient wants. The doctor is basically just a vending machine in that model. So if we were going to handle Samantha in that way, we would say, terrific. How can I help you to go and get the oral sodium chloride? And then finally, there are the newest models, which I call the in-between models. And there's 2 of them, consumerism and shared decision-making. And here, patients' values and goals are central, and patients do define how they want to get there, but it's recognized that they may not have it all worked out yet when they first get there. They may need some help as far as weighing the different options that are out there. So in consumerism, the doctor's job is to be like a living encyclopedia and to say to Samantha in this case, okay, here are the pros and cons of oral sodium chloride. And in shared decision making, the doctor can take it one step further and say, here are the pros and cons. And based on my years of training and experience, here's what I suggest. So each of these models has some pros and cons. So paternalism, I mean, doctors really do have a lot of years of training and experience to be able to evaluate different healthcare options. Also, this has been around for hundreds of years, this model, so there must be something about it that satisfies both parties. But of course, there are some weaknesses, right? I mean, doctors and patients don't always share the same values and goals. They don't always share the same concept of what is acceptable risk. Also, patients are not all the same in terms of how they want their information. In fact, the literature talks about 3 categories of patients. One is called an active seeker. That is somebody who wants to know everything about this condition right now. Give me a fire hose of information, doc. I want to know it all. More common are the selective seekers. They just want a trickle of information. Okay, I know I have ALS now. What do I need to know to get me through the next few months? Let's not get too far ahead. And then finally, the hardest group of all are the information avoiders. Those are people who just want to pretend it's not happening, and they don't want to hear anything about it. They want the information to be given to a family member or friend and have it funnel into them sideways. The biggest problem with paternalism is that it can and has been abused, both at the bedside and in clinical research. And in fact, those abusives have really sort of formed the backbone of modern malpractice law, as well as modern informed consent law that applies to research. What about autonomy? Again, good things and bad things about it. The good things are that patients' values and goals should be at the center of all this. But the bad thing is, remember, we've already talked about the fact that people might be using flawed information to make their decisions. So by taking the doctor out of the picture, those decisions might not be as good as they could be. And then finally, you've got the in-between models. So the nice thing here is that this utilizes the talents and experience and priorities of both parties, right? The bad thing about this is that it takes more time. Have you noticed how time in medicine is becoming more scarce? How much time do you get with your primary care doctors now? I get about 5 minutes once a year with my primary care doctor. So this is a universal thing. And you can imagine that it's much faster for a doctor to just tell Samantha, don't do this. Or, yeah, just go for it. Go ahead and do it. Than it is for the doctor to say, you know what? I don't know that much about oral sodium chloride. I'm going to go home and do some research about it and then get back to you with the pros and cons and a suggestion about what I think we should do. That takes a lot more time. So which of these models should we go after? Well, if you poll patients and you poll doctors, you find the same thing. The great majority of both groups prefer shared decision making. And also there's evidence that shared decision making is associated with better health outcomes. That's data from blood pressure and diabetes studies. You can imagine as patients that if you had a bigger role in deciding what you were going to do about your disease, you might be actually more likely to follow through with it than if somebody else just told you this was what you were going to do. So if that's what we're going to pursue, how do we deal with the time issue? Well, the answer came to me in 2007. I was sitting at the International Symposium, and I saw one of my European colleagues give a very interesting presentation. So at the time, one of the most popular alternative therapies in the world was happening in Beijing, China. There was a Dr. Huang whose idea was to inject fetal olfactory cells into the front of the brains of people with ALS. So he would drill holes in the skull and inject those cells in with a needle. And on his website, he was claiming that this was very safe and that 50 to 70% of people going to that clinic were improving. So Dr. Vandenberg's patients asked him about it, and he decided to go ahead and try to investigate this. So he went to the clinic. He interviewed Dr. Huang. He interviewed patients and families that were there. He followed patients that went to the clinic to see what happened to them. And then he took it one step further. He actually presented his findings not only to those patients that asked about it, but to the whole world, right? And what he found was really no evidence of any objective benefit in the patients that went to this clinic, and definitely harms coming to people that were not being documented, even blood clots in the leg, and even a death that wasn't recorded anywhere. And this was very expensive, $25,000 per cycle. So Vandenberg engaged in shared decision-making with his patients, and then he shared his shared decision-making with the world. So I wanted to try to make this kind of thing happen more often, shared decision-making. So I created this project, ALS Untangled. I built it within the structure of the National ALS Research Group, or also known as the ALSRG. And our motto, again, came from an old X-Files poster. The truth is out there. And so we try to find it by using a three-part method. First, where do we get our ideas for the things we investigate? Second, how do we actually investigate them? And then third, how do we get the results of our investigations out to the world? So our inputs come in from lots of different sources. So if you ask your doctor and clinic about an alternative therapy and they don't know the answer, they will usually email me about it, and I'll put it on a list. You can email me. My email's all over the internet. And we've got a Twitter feed, Twitter. So the nice thing about Twitter is that you don't have to remember anybody's email address. So if you sign up for a Twitter account and you just remember the word ALS Untangled, one word, every night, all of the tweets from around the world that have the word ALS Untangled in them, they come to my phone. So if somebody in Russia wants to know about a chelation clinic in Siberia, all they got to do is type in ALS Untangled. What about this chelation clinic? And I can find it. So the other nice thing about Twitter is you can get an idea of how many people are interested in what you're doing by looking at the number of followers that you have. So the first year we were open, we had about 100 followers. And we've slowly but steadily increased. And we're actually now approaching 2,000 followers, which I'm pretty excited about. Now, my wife always puts me in my place, and when she saw me putting this talk together, and I told her how excited I was, she reminded me that Lady Gaga has 33 million Twitter followers. To which I replied, but she has her own stylist, and I have to put these looks together myself. The other thing is you can get an idea of how frequently you're sending tweets, and tweets are coming in, and we're getting an average of about a tweet a day now. So as a result of all this Twitter activity, the list of things that people want to know about that's on our website, alsuntangled.org, has really exploded. In fact, it's gotten to be so long that it will not fit on a slide anymore. I could not shrink this down enough to get all these things on a slide. So we're up to about 160 alternative therapies that patients want to know about that we're working on. And we've got so many of these things that we had to do something to prioritize. You know, these things take me 1 to 2 months to actually investigate. So 160, that's probably more than the lifespan that I have ahead of me. So I've asked people to vote for the things that they most want us to investigate. So if you're interested in these kind of things, you go on our website, all you gotta do is click vote next to the one that you want, and it'll move it up the scale. And you can see that some of the things are way above everything else. In fact, there's one thing called MitoQ that I'll tell you about a little later, which had almost twice as many requests as anything else that we've ever looked at. How do we do our reviews? Well, just like Fox Mulder had a team that helped him, I've also got a team, and my team has grown, and we now are comprised of about 100 clinicians and scientists that are linked together across 10 different countries that are working on these reviews together. Mostly we communicate by email. The way things work is that one person, usually me, writes the first draft of one of these reviews. And there's a sort of a standard operating protocol by which we try to put this together. So we make multiple attempts to contact the person that's selling the alternative therapy. We try to get the materials from the clinic or from the company that's selling it so we can see what claims are being made. We search a website called PubMed. That's a way to find scientific publications. But we also search other things that scientists don't usually look at because the information that we're pulling in, it's not usually on PubMed. So we do a Google search, and there we find news stories and blogs about this thing. We look in a website called ProAct. It's a gigantic database that has information from patients with ALS that have been in 17 previous clinical trials. So there's thousands of patients with longitudinal data, and we know what things they were taking throughout the website. So we can look to see if somebody maybe is taking oral sodium chloride, like Samantha wants to know about, and we can see what happened to them before and after. There's another website we look at all the time, and that's called Patients Like Me. It's a giant online community, and people that go on there can track the treatments that they're taking and also track their disease outcomes. And so we can look on there again to see what happened before and after somebody started taking something like oral sodium chloride. And then finally, we try to visit the clinic like Dr. Vandenberg did, to interview the person who's selling this stuff, and ideally to interview some of the patients that they consider to be their best successes. This past year, in response to some suggestions that we had from patients and other scientists, we decided to make this a little bit more rigorous. And we created something called a table of evidence. So I don't know of anybody else that's trying to look at these kinds of unusual treatments in any other disease. So this is just something that we made up. We crowdsourced this. We came up with an initial draft, and we sent it around to our team of 100 clinicians and scientists, and we got feedback, and it went through multiple iterations. And this is what we came up with. So for every ALS Untangled investigation, we are going to look at 5 things. The mechanistic plausibility. Does it make any sense that this could work for ALS? The preclinical models. Has this ever been used in a model for ALS, like cell culture model or animal model? Case reports. Are there any case reports out there? Patient trials. Are there actually any clinical trials? And finally, risks, harms that have been documented in people who are taking this particular thing. So those are the categories. And each category, we grade from A to F. And we have specific cutoffs for getting different grades, okay? And then there's also a category U, because sometimes there's just no information at all about a particular thing in a particular category. So hopefully this table of evidence makes our reviews even more objective, and it also allows patients and families who might have different priorities to rank the different alternative therapies that we've reviewed for themselves. So we're not going to tell you which one we think is best, because I don't think there is one that's clearly better than another. But you as a patient may be swayed by different types of data. Some of you may look at this and say, well, I only want to take the safest possible stuff. So for you, the risk category is going to be important, and you'll look to see things that might have got a grade of A or B for risks. Other people may say, I don't care that much about risks. What I want to do is take stuff where people with ALS, a validated diagnosis of ALS, definitely got better. So there you would look under patient case reports, and you'd look for grades of A or B. So you can rank these for yourselves. So then we finally put this into a draft. It's usually a short paper. There's a very specific format. What is this thing? Where'd the idea come from? How would a person with ALS get it? What's the rationale? What are the data? What's the safety issue? How much does it cost? And then finally, what do we recommend? We circulate these drafts amongst all of us. We finally come to a consensus, and we submit it to the journal, ALS and Frontotemporal Dementia. It's the main journal for researchers working on ALS. And the journal has made a nice deal with us to publish these reviews for free. So every other article that the journal publishes, people have to pay for to read. This one is always free. So these are all the different reviews that we've now completed. In fact, we just completed another one that's not on here, but you can see the kind of things that we've looked at: iPlex, a chelation clinic, lots of stem cell clinics, something called Marty Murray's method, goat serum, naltrexone, blue-green algae, Dean Kraft's energy healing, bee venom, coconut oil, cannabis, Lyme treatments, oral sodium chloride for Samantha, the Deanna protocol, whole bunch of things. If you want to read the whole review on our website, all you do is go here and just click on the name. If you want to see what the grades are for a particular thing, you can see that without clicking on anything. So that's the program. Now I'm going to just shift gears a little bit and tell you about some of the lessons that I've learned running this program for the past 6 years. And the first group of lessons has to do with the people that are selling these things, what I call the proponents of the alternative therapies. And I'm going to be honest, when I started this program, I had this idea in my mind that the proponents of alternative therapies were a lot like the old Wild West snake oil salesmen, that they were very shady. And what I've learned is the motivations of these people are variable. There are definitely some snake oil salesmen out there. So by far the worst of the folks that we've investigated is this one. His name is Larry Stowe, and he was in Mexico running a clinic, calling himself Dr. Larry Stowe. He had a protocol that involved some sort of stem cell concoction and a whole bunch of other supplements. He was charging over $100,000 per cycle, and he was telling people that he was working with American universities and the FDA, and that people were literally getting up out of their wheelchairs and getting back to the gym while they were using this treatment. So 60 Minutes actually partnered with us on this investigation. You can watch a video called 21st Century Snake Oil that's on their website about this guy. They were able to help us show that Larry Stowe does not have a medical degree. That was forged, never went to that university. None of the American universities that he reported working with had ever heard of him, nor had the FDA. And there was not one shred of evidence that a single person had any improvements on this therapy. And after that aired on 60 Minutes, he fled, he disappeared for a while, eventually was finally caught, and happy to say that he's now in prison. What about these folks? We said there were some strange things about this MotoTab website, right? So remember I told you that this was run by a group called Oslo Health Solutions in Oslo, Norway. Well, we tried to get in touch with them as per our standard operating protocol, no response. So we did a Google search of Oslo Health Solutions, and we found something very interesting. This company has dozens of virtually identical websites. The same clip art, all the same text, including clinical studies soon to be posted here. The only difference between all these websites is the beginning of the name of the product and what it's used for. So they advertise PeriTab for peripheral neuropathy, AmyloTab for amyloidosis, OsteoTab for osteomyelitis, MDTab for all types of muscular dystrophy. Very strange. Well, remember, there was this other group that supposedly had tested some of these things that this company had, Society for the Promotion of Alternative Health. That group is in Glasgow, Scotland. So we reached out to them, and unfortunately we got no response. So we Googled the name of that company, and guess what? They also have dozens of virtually identical websites where they test a product that ends in tab compared to one that ends in tin and one that ends in tax. And they always come out the exact same way with the same number of check marks in all the boxes, and the tab product always coming in second. It's very, very strange. So then one of our patients actually taught us that you can find out who really owns any website by going to a server like GoDaddy and typing in the command who is. So if you type in who is Oslo Health Solutions, who is Society for the Promotion of Alternative Health, all these websites are owned by the same two brothers who live in Pakistan. So this is clearly just a complete scam, all this. But you know what? Much more common than these snake oil salesmen are what I call true believers. These are people who really think they have something that works for ALS. They're not scientists, and they just don't know how to really test it. So one of these people is this gentleman standing next to me here, Dr. Joe Hickey. He runs a chelation clinic in Hilton Head, South Carolina called the Hickey Wellness Center. Chelation is taking the metals out of a person's body. So Hickey believes that metals cause a lot of human disease. Now, how do I know that Hickey's a true believer? Well, I spent a couple days with him and his wife, and the first thing they did is showed me the inside of their own mouths. They've had all their fillings removed. And also, I watched as the clinic closed, just about every week, they chelate each other. So they're using this treatment on each other to try to prevent any disease from happening to them. So it's hard for me to fault their belief. Beyond just being true believers, some of these proponents do things incredibly well that mainstream doctors need to pay attention to. So when I talk to the patients in these clinics around the world, including in Dr. Hickey's clinic, the first thing I always ask them is, tell me your story. How did you wind up here? It's amazing how similar the stories are. People tell me, well, we started off in a mainstream ALS clinic, famous doctor. And you know, we went there and it was just such gloom and doom. Like we never got any eye contact from the doctor. We never had any optimism. We would ask about things like, you know, alternative therapies and they just shut us down. And sometimes if it was after clinic and we asked like by email or telephone call, it would be days or weeks before we even got an answer back. Well, Dr. Hickey was the exact opposite of all that. He was the most optimistic person I think I've ever met. He was incredibly respectful. If a patient came to him and said, Dr. Hickey, I'm not sure the chelation's working, but I want to try this. Oh, you want to try that? Okay, here you go. He would very autonomous, give the prescription for the patient to try it, no real discussion about it. And very responsive. It didn't matter what time clinic ended. Dr. Hickey made sure that all the patient's messages, phone calls and emails were answered before he went home. And if I had to pick 3 things that I think are just essential for a doctor working in ALS, optimism, respect, and responsiveness. So the next group of lessons I learned is about the treatments themselves. When I first started, I thought all these things were going to be about as bogus as this old Bigfoot picture. And we have found a lot of bogus things. Rather than go through all those, I will tell you how to look at a treatment and decide if it's probably bogus or not. These are the so-called red flags, okay? First of all, if you see a treatment where somebody's advertising this as dramatically effective or a cure-all for a large number of the world's worst diseases that seem to share nothing in common, I would worry. Think to yourself for a second. If somebody really had the cure for ALS, Parkinson's, Alzheimer's, MS, all types of cancer, diabetic neuropathy, and fibromyalgia, why would they be practicing in a strip mall next to a Kentucky Fried Chicken in India? They should be like the most famous, wealthy person in the history of the world if they could cure all those things, right? Second, anything that somebody advertises as perfectly safe, no. When we do trials, people have complications on placebo. There is nothing in this world that is perfectly safe. Those words should never appear on a treatment. Anytime you have a clinic where there's a non-MD making medical recommendations, or a clinic where there's no informed consent for you to sign, there's no IRB, there's no oversight making sure that your safety is being protected, worry about that. Anytime somebody wants you to put up a large chunk of change before you even get to try that, worry about that. And then if I had to pick one of these things that's the most reliable way to tell a bogus therapy, if a person wants to give you something and never wants to see you again after that, unless you want to pay for it again, that's bogus. Anybody who's doing real research, they want to see what happens to you after you experience the treatment. They want to follow you, measure things. So don't go someplace where somebody wants to take your money, give you something, and then never see you again. That can't be legitimate. But you know what? Every once in a while on the X-Files, there would be an episode where something happened that they never could really explain. One of my favorite ones was the one in this slide here. It dealt with a guy named Squeeze. It was this guy who had these weird green eyes, and he could contort his body down and travel through very small spaces. They never did figure out what the deal was with that guy. So just like that, every once in a while, something really strange that a patient asks about might actually work, okay? So why would I put them on this list? Well, first of all, some of these things have a mechanism that makes perfect sense. Second, some of them have multiple case reports where I either have the records and I believe the person had ALS and they're better, or people are saying the same kinds of things, right? Third, many of these things do appear to be reasonably safe. Now, when I give this talk to doctors and scientists, sometimes I see their eyes get really big when I put this slide up there. But the thing is, other treatments have been found to be useful by accident like this, by patient reports, right? One of the most successful treatments, most profitable treatments in history was an accident. Do you know the story of Viagra? It was being tested for heart disease, and the company was about to throw it in the garbage when it didn't work, and then all the guys in the trial asked if they could stay on it. The company said, what's going on? And the next thing you know, they completely changed gears because of unexpected patient reports, and they've got a drug that works for something that never worked before, right? And it's $1 billion drug. And in ALS, we've got a drug called Nudexta that's the same way. Nudexta was being tested to slow down ALS progression, and it did not work. But in the trial, people came forward and said, you know what, my laughing and crying is so much better, I'd love to keep taking this. Companies switched gears. An unexpected report from patients switched gears. Now they've got the first ever FDA-approved drug for pseudobulbar affect. So this should not be considered to be heresy at all. So let's talk about some of these treatments. So the first one is this, Ames Pro. It's hyperimmune goat serum. They actually make this by inoculating goats with inactivated HIV and drawing off their plasma. What is in there? A whole bunch of things that modulate the immune system. That's a plausible mechanism. We think that neuroinflammation is involved in the progression of ALS. We've gone after that with multiple mainstream trials. What's the evidence that this might work? Well, we've got one published case report. And this is very interesting because the article was published by the patient with ALS, who happens to be a doctor. And what he did is he published this graph showing what was happening with his breathing function before he started on Ames Pro, at a low dose, a medium dose, and a high dose. And I think you can clearly see that his breathing function was slowing down as far as progression and eventually started getting better. That's kind of unusual in the history of ALS. Usually it's a pretty straight line. So what are the problems with this? Well, first of all, we've got a little bit of a bias here. Remember, we talked about the placebo effect before. When a person is trying something, they're going to have a strong belief, a strong hope that they're better. There isn't anybody who objectively measured this in this patient other than himself. Second, we don't know if he can accurately measure his pulmonary function tests. We don't have any kind of testing of his testing. And then finally, he's combining a whole bunch of different measurements into just one score, which is not something that we usually do. I don't know if it works. Other pieces of good news, not many side effects. This patient didn't report any. This has been used in patients with other diseases now, and I can't really find any serious side effects in anybody. One piece of bad news is it's expensive. It's about 19,000 pounds per year. Now, the company is now actually planning further ALS studies, so they will help us figure out whether this works. Here's another one. It's called Lutimax. What is this? It's a combination of vitamins and flavonoids taken orally. And the idea here is that you'd reduce oxidative stress. We know there's lots of free radicals in the cells of people with ALS. It's a mainstream idea for treatment. We've gone after this with mainstream trials before. So this could work. What's the evidence? Well, there's two things. First of all, there's this video, which is in your handout. You probably can still watch it online. But this is a patient who reports that he had ALS and reports that he couldn't lift his arms up over his head. And then a little while after taking Lutimax, kind of like Popeye with spinach, he gets his arms up over his head. That's unusual. There's also a small pilot trial that was done by one of my colleagues, Dr. Elijah Stommel. So this was a 25-patient trial. Everybody in the trial got Lutimax, and their progression was compared to a historical control group from another study. So here's the folks on Lutimax, and here's the historical control group, and you can see that the patients on Lutimax are progressing more slowly. The bad news about that study, open label, non-randomized, not blinded, and a huge amount of patients dropped out because they were losing weight on Lutimax. In order for this to work, you're supposed to go on a carbohydrate-restricted diet, which can cause weight loss. It's not very expensive, $25 to $200 per month, depending on what dose and where you get it. Lunasin. So we're going to talk a little bit more about this in the next session. But this is a small peptide originally isolated from soybeans that is said to have antioxidant, anti-inflammatory, and histone-altering properties. So the pattern of genes that a person has turned on are regulated in a complex way, but one of the ways is through histone acetylation. We know that histone acetylation is abnormal in people with ALS. We know that the pattern of genes in people with ALS is abnormal. People with ALS have all their destructive genes turned on and all their protective genes turned off, which is the exact opposite of what should be happening. We've tried to go after this mechanism before with a drug called sodium phenylbutyrate. We didn't have any luck, but maybe this would do it better. So the mechanism gets a high score. What's the evidence? So a person sent me this video clip last year of a guy named Mike McDuff from Providence, Rhode Island. So Mike McDuff was on the news saying that he was diagnosed with ALS by 3 different doctors, 2 at Mass General, 1 in Providence. As of a year before, his ALS had progressed to where he couldn't speak, and he couldn't swallow, and he had a feeding tube, and his arms and legs were getting very weak. He needed help with activities of daily living, things like that. So he started taking this Lunasin on the advice of a family friend, and a year later, his speech is back to normal. And his swallowing's back to normal. He's had his feeding tube taken out, and his arms and legs are measurably stronger. So I got Mike McDuff's records, and he's right. I think he has a form of ALS called progressive muscular atrophy, and he goes to an ALS clinic, so I have lots of measurements that are all moving in the exact opposite direction as what you would expect in a person with ALS. There are other patients that I've heard about online, but I don't have any of their records. Side effects seem to be very rare. The bad news is it's fairly expensive. To do the regimen that Mike McDuff did is $700 a month. But as I'll tell you about in the next session, we're going to be doing a clinical trial of this at Duke. This is the newest ALS Untangled. It's not even been released yet. It's still with the publisher. It's the one that had almost 2,000 requests. It's called MitoQ. So what is it? Well, it's an antioxidant, again, to combat oxidative stress. The antioxidant is called ubiquinone. It's the same antioxidant as you find in coenzyme Q10, which we were very excited about for ALS for a long time until we did a trial and it didn't work. We didn't find any evidence that it was better than placebo. But this is a little different. So in this case, ubiquinone is attached to another molecule that is lipophilic, meaning it has affinity for fats in the body, and it has a positive charge on it. So the net result of that is that this molecule can easily get through the gut, through the blood-brain barrier, into neurons, and the positive charge makes it concentrate in mitochondria. Mitochondria are like the power plants of cells. Now, why would you want to make it concentrate there? Well, that's where most of the oxidative stress in cells happens, in the mitochondria. And the mitochondria are actually the most vulnerable part of the cell to oxidative stress. So if you wanted to pick a place where you'd want the antioxidant, that's exactly where you'd want it. So this makes a lot of sense. There actually are preclinical studies in a cell model of ALS and a mouse model of ALS, both of which showed benefit. We have multiple non-validated cases. We don't have records on any of these folks who are reporting benefits from this. It appears to be reasonably safe. Nobody has any serious side effects on this. And the good news about this is not very expensive. It's about $70 a month, a lot less expensive than most of the other things. So I'm hoping that we can see a clinical trial of this in the near future. And last but not least, we come to the strangest thing anyone's ever asked me about in all my 6 years. And I have to be honest, when this tweet came through late one night, I thought it must have been a spelling error. I thought the person must be asking about fetal transplants, not fecal transplants. Nope, they wanted to know about fecal transplants. So I did some reading and I found out that this is actually now mainstream therapy for some diseases of the colon, like, for example, an infection called C. difficile, and also for Crohn's disease. The idea in those diseases is that the family of bacteria that lives in the gut may be altered, and you may have one bad group of bacteria that overpopulates the gut, and that might be the reason for the disease. And the way you would treat that is by taking the stool from a healthy person without the disease and putting it into the colon of the person who's sick and reestablishing a more normal microbiome or family of bacteria. So why would this work for ALS? Well, it turns out that somebody published a paper 10 years ago that just kind of got almost no notice that this could be a cause for ALS in some people, just a hypothesis paper. But it pointed out that there is a bacteria called Clostridium that actually can secrete a toxin that can get out of the gut, cross the blood-brain barrier, and kill motor neurons. So it is possible that this could actually cause ALS. Is there any evidence that that is happening in people with ALS? Not yet, because nobody's ever looked at the microbiome. But I do know from my practice that lots of people with ALS have bad constipation. And there's a lot of possible reasons, but one could be that they have an altered microbiome. There is one other piece of evidence, and that is I talked to a person in Australia who runs the world's largest fecal transplant clinic. This is a doctor, Dr. Barity, and he told me he saw a patient a few years back who was wheelchair-bound from their ALS, came to his clinic because of severe constipation, got a fecal transplant, and the next day he was walking. And the day after that, he was dancing. And then he disappeared. He left Australia and he never saw him again, so he doesn't know whatever happened to the patient. But that's pretty amazing. There are published case reports of fecal transplants helping people with other neurological diseases, Parkinson's, MS, autism, Alzheimer's, myasthenia gravis. So this is pretty safe, and it's not very expensive. So I'm hoping that in the next year or two, we're going to start seeing some microbiome studies in people with ALS to know if they have this Clostridium. So this has not all been rosy the past 6 years. We've had some challenges. First of all, there's a widening gap between the number of requests and the number of published reviews. Second, people have criticized us because the proponents of AOTs feel like they don't have a great stage that they can have a rebuttal to what we say. Third, I'm not sure how to measure how useful this program is. And finally, up until just recently, we haven't had any resources to study the things that we think are interesting. So here's how we met some of those challenges. First of all, the funding challenge. So as most of you know, last summer we had something amazing happen. The Ice Bucket Challenge brought in $220 million worldwide. And as a result, there's a lot more grants that people can apply for. So we've actually got grants from the Motor Neuron Disease Association and the ALS Association to help fund this program. And the purpose of this is now to allow us to spend more time on it, to buy some of our time so that we can publish a greater frequency of reviews. We're hoping to double the number of reviews that we put out this year. Rebuttals. What I decided to do here is I decided to take the Twitter feed and make it the homepage of my website. So if you were to go home tonight and say, I thought Bedlack's talk was ridiculous and the only thing worse were his boots, and you put it on Twitter, it's going on my website, and I can't do anything about it. So, is it useful? Well, I've heard good feedback from patients and families and from colleagues. The journal actually keeps track of the most read articles down here in the lower right-hand corner of their website. And it seems like almost every time I've looked at it in the past couple of years, all 5 of the top 5 most read articles in the journal are ALS Untangled reviews, which I'm very excited about. But in the interest of full disclosure, remember, ours are the only ones that are free, so that probably helps. ALS Reversals. I'm going to be mentioning this more in the next hour, but this is something that is very near and dear to my heart. And we finally now got some funding donated directly to the Duke ALS Clinic as a result of the Ice Bucket Challenge. That's going to allow us to start a program to study people like Nell DeBoos and Mike McDuff to understand why did they get better and to try to make it happen more often. So just to kind of summarize, we think investigation of alternative and off-label therapies is both timely and important. We believe the truth is out there, but it's not easy to find for doctors or patients. So this program is using social networking to bring all of us together to systematically investigate these things. We're learning some interesting lessons. We've had some challenges, but we're addressing these, and hopefully people are finding this useful. So let's go back to Samantha and see how we would handle her using ALS Untangled. So we give her a copy of the review that we did on oral sodium chloride. She takes it home and she reads that sodium chloride is the active ingredient in a drug called NP001. This is an IV medication that's being made by a company called Neuraltis, and the idea is that this blocks part of the immune system called macrophages from getting activated. This worked in an animal model of ALS. A small human study was done. It appeared to be safe and tolerable. There was no effect on the primary outcome measure, but they did a subset of patients. They did a sort of a sub-analysis, and they did something called the responder test. And they found out that about 27% of the people on this drug had no change in their disease for 6 months compared to 10% of people in a controlled database. So it looks like there may be a subset of people that respond to this, so that's very exciting. But remember, that's IV sodium chloride. And what she's asking about is oral sodium chloride. So you can buy oral sodium chloride. It's actually used as a bleaching agent for water. And I called some of the people who developed sodium chloride to ask them why they went to an IV form. And what they told me was if you take this orally, saliva rapidly hydrolyzes the molecule. And one of the things that comes out of that hydrolysis is something called chlorine dioxide, which is a poisonous gas. So in the first small study of this that they did in their lab in Germany, 2 of the patients became unconscious and had to be rushed to the hospital. So they stopped oral development of this. So what we said is we don't recommend further use or study of oral sodium chloride until, first of all, it can be shown to be safe, and second of all, it can be shown to be absorbed at levels that affect macrophage function, like IV. So maybe Samantha reads that and she's so impressed that she decides she's not going to pursue that after all. She's going to try the clinical trial, and maybe she has such a good experience that she becomes a research advocate and even attends one of our clinical research learning institutes to become a research ambassador. So I just want to thank a few people at the end of all this. First and foremost, patients. You know, you're the inspiration for this program. You provide us with the information that we need to write these reviews, and now you're even helping us to fund the program through your Ice Bucket Challenges, so thank you. Lots of groups involved in helping us, ALSA and MNDA, which fund this, the ALSRG, from which the investigators come, the WFN ALS and MDA that help to publicize our reviews, the ALS Journal that publishes them all, patients like me, Mass General Hospital, Alex Sherman, for helping us to review the databases, 60 Minutes for teaching me to be a better detective, as well as Quack Watch, et cetera. So thanks very much, and I'll be happy to answer any of your questions. Yes, sir.
What's the approach to go to your healthcare provider and say, hey, I heard about all these things. Why don't we get going on something?
You mean to try it for yourself?
Yeah.
Well, you know, every doctor is different, just like every patient's different. So hopefully, if you want to try something, you can find a doctor that's willing to work with you that way on a shared decision-making type model. But I think, you know, if you were to take one of these reviews in there and say, hey, listen, I've done a lot of research on this, and we've got this, you know, mainstream group here that's reviewed this, and based on what I see here, I'm comfortable with the risk-benefit profile, and I want to try this. I don't think most doctors would have a problem with you doing that, but I can't speak for all doctors. Yeah.
And if for some reason you go to your doctor and they say, no, go to another one?
I mean, I think that would be up to you. You know, it'd be a question of, is there a whole bunch of other things about that doctor that you just love, and that's the one thing that you don't like? And maybe if that's the case, you can have a conversation with them and try to get that part of it changed. But yeah, I mean, I think if you're in a place where you don't feel that your doctor is optimistic, respectful, and responsive, go find one that is, because, I mean, I think you deserve that.
Okay.
Yeah.
And I'm sorry.
But no, that's for everybody else.
Yeah.
Should be on.
Should be in.
Yeah.
I think you're also saying, go to the doctor. Don't try something on yourself off the internet or whatever source.
Yeah, again, I think that shared decision-making is the model that I really like. And, you know, by definition, that means that we got together and we talked about it. And part of the reason I want my patients to feel open about this is I just want to make sure they have all the right information before they make a decision. Because as you've already seen, some things sound so amazing out there, but there's really no substance to it. So I'd rather have them try something where the claims are maybe a little bit more reasonable, and we really have reviewed it and we know what we're getting into from a safety and cost standpoint. At the end of the day, it's up to the patient and family to decide what they want to do. But I would love to have an open conversation and be part of that decision making.
Thank you very much.
Yeah.
If you have a patient on a clinical trial, but they're also using ALTs, how does that complicate things?
Yeah, so that's another reason why I think it's important for us to be open about this, because whenever we do research, we want to try to make that research as clean as we possibly can. So I actually consider all the things I've talked about today to be experimental therapies. So whether somebody's actually testing them in a mainstream clinical trial, or whether people are just asking about them as an alternative therapy, I think they're all experimental. So I try to not have people, you know, on multiple things at the same time, because I'm just not sure at the end of the day how we would ever analyze that data. Yeah, I mean, we need the trials to get us closer to the cure for ALS. So, yeah.
I have a question. I read that a high-fat diet is best for people who have ALS. And my father had a high-fat and high-protein diet, and my father's been having eggs, and my mom's been trying to do anything, you know, that's high-fat milkshakes. My dad also went to the doctor, and now his cholesterol is very high. So do you recommend the high-fat diet? Is there anything else that you recommend that, you know, could that potentially be harmful?
Yeah. So we're not as smart about diet as we would like to be. So we do know something that we didn't know 15 years ago, and that is that people with ALS who lose weight progress much faster than people who don't. So to me, the most important thing is trying to find a diet that a patient can tolerate that allows them to be weight neutral throughout the disease. The question is still open as to what kind of diet is best. There's one very small study that's got some problems. There's another much larger, better study that's being planned, but I don't think we have the answer yet. So I would encourage folks to find a diet that they enjoy, that they can tolerate, and that allows them to keep their weight stable throughout the disease.
I also have one more question.
Sure.
My dad has a family doctor that is very hands-on and really encourages him to go for all sorts of tests that, you know, to test his cholesterol, to test this, that, and the third. But with having ALS, if he goes to the doctors and people have the flu there, I feel like that could potentially be more harmful. Is there a point where you think that, you know, some tests are unnecessary and could be possibly tiresome and risky of just getting different, you know, the flu or a cold? What is your take on that?
Yeah, it's a question I get asked all the time in my clinic, and I think the answer really kind of depends upon what that person's ALS looks like. So there are some people that have, you know, very rapidly progressive ALS, and you know, you can unfortunately see that their time is most likely going to be short. And for those people, I encourage them to enjoy the time that they have, not spend time in doctor's offices, testing out different medications that are designed to try to prevent complications that might happen 10 or 20 years down the road, because the chances are we may not get there. If we find a cure for ALS, then we'll readdress all that stuff. But there are other people whose ALS progresses so slowly that they may live decades. And for those people, all those health maintenance things do matter. It'd be a shame to have somebody like Stephen Hawking, who was going to have ALS for 50 years, but because you didn't pay attention to their cholesterol, they died, you know, at age 50 of a massive heart attack. So I think it really depends upon the patient. People with this disease are very different in terms of how they progress.
Thank you.
Yeah.
Thank you, everybody. I think that's going to be our last question. I think we'll go to a break now. We want to give you a moment to pause, since you'll be our second presenter for the day.